started back in 1996, and we grew the practice to a medical model-based clinic. So we provide care for infants all the way to our seniors. We are a service-based provider, and we happen to provide exceptional service through delivery of eye care. Our team is very interested always in putting the patient's care or needs first. What we did initially when we started practice was understanding that patients will need different types of care based on their diagnosis. We want our patients to feel that they are never hurried and that all of their concerns, for whether their concern is longevity of their eye health, cosmetic, or the general comfort, we want to be sure that we're addressing all of those issues or concerns that patients have. And also to be able to educate our patients on how to attain that longevity throughout the years. Discussions on ocular nutrition, the environment at which they are surrounded, screen time in terms of their jobs, and even certain hereditary components. We like to be sure that we are educating our patients on every aspect of the eye health, and to combine that with the technology that's now available that could help with the comfort and clarity of their eyesight. We are more interested in creating an at-home environment for our patients. And I think that a lot of our patients really appreciate the personal touches. Personal phone call from our team members or from the doctor regarding a medical procedure, how things are feeling and what the expectations are. Our patients are treated more like family rather than an insurance number. We are the only clinic in the area to offer 2 floors of eyeglass wear for our patients. We do have an in-house lab for same-day service in some cases for eyeglasses and for contact lenses for that matter. Our staff is one of the most comprehensively trained, and we're always seeking further education for newer products and newer technologies to help facilitate the most efficient and most comprehensive examinations for our patients. Cataracts happen in every patient. If we all live long enough, we'll develop a cataract. It's a film that grows over the focusing lens inside of the eye. So generally, if you think about a window that's getting dirtier and dirtier, it's harder to focus through that particular window. Cataract surgery involves actually removing the focusing lens through lasers. There's no stitches, no needles, no eye patches that are used. The procedure is actually a little less work than a tooth filling. It takes about 10 to 15 minutes to remove the cataract. Typically, if a cataract exists in both eyes, we'll do one eye at a time, and following about a week to 2 weeks, we'll do the other eye. So it involves removing the dirty window and putting a clean window in its place to allow the patient to be able to focus. Many times, after the cataract surgery, patients will no longer need to wear eyeglasses to see near or to see far away. Dry eye is probably the most underrated ocular surface disease that patients suffer from, and some of our patients put up with it. But essentially, it's what we call a multifactorial disease that affects the surface of the front part of the eye. There's varying symptoms, all the way from a dry, scratchy, kind of sandy feeling into the eye to an eye that's excessively watering, where patients are feeling like their eyes are tearing up all the time. Certain elements of redness and even blurred vision can manifest as a result of, again, different varying degrees of dry eye. In our Dry Eye Center of Excellence, when we are counseling patients for their dry eye disease, we will evaluate the patient's glands. There are about 20 of these glands in the lower eyelid that serve to function to create the enzymes and antibodies that we need to prevent not only dryness, allergy, and infection, but create a sense of lubricity for those 14,000 blinks that we do every day. So without that glide of the eyelid over the ocular surface, we tend to get friction. So the eyelid is now rubbing on the eye, which creates an element of inflammation. That's where the redness comes from, the scratchy, dry, kind of sandy feeling in the eye as well. LASIK is an acronym for laser-assisted in situ keratomelusis, and it involves creating a flap of tissue in the cornea. Intralace simply creates the flap using a laser. It is the most accurate, and we get a very even computer-assisted thickness for the most perfect flap. Almost every patient is a good candidate for Intralace, and in fact that's pretty much the only way we perform the procedure now at this time. The only times that patients would not be a candidate for Intralace would be based on the patient's corneal thickness. So it's very, very important when we are doing a preoperative evaluation. The first thing I look at is the patient's corneal thickness, and then I'll look at their prescription. That's how important it is to check the integrity of the cornea for any patient undergoing any type of refractive surgery. Patients' expectations can be a little bit of a faster surgery and significantly more accurate, again, in the flap thickness. Intraocular lenses are the clean window. If you think about a window that's getting dirtier and dirtier, it's harder to focus through that particular window. What happens when a cataract, the dirty window comes out, the clean window gets in. Intraocular lenses can be monofocal or single vision, so this allows patients to see very clearly at a distance without the use of eyeglasses. There are also what we call premium or self-focusing intraocular lens implants, or IOLs, and this facilitates the clarity of vision for computer screen, up close, and distance all at one time. While on the operating table, we're able to make measurements to get the very, very best intraocular lens implant for our patients. Laser eye surgery is used to eliminate the patient's dependency on eyeglasses or contact lenses by using a laser to reshape the front surface of the eye. So we're able to remove astigmatism, nearsighted and farsightedness. The best candidates for laser eye surgery is a patient, number one, whose axial length or growth of the eye has completely stopped. So this is going to be somewhere between the ages of 19 to even 23 years of age. The best candidates are going to be those patients who are not suffering from dry eye, patients who don't suffer from keloid scarring, and patients generally under the age of 60, only because cataracts sometimes start to form between the ages of 60 and 70 years of age. Choosing primary eye care associates for laser eye surgery, I think number one is based on our experience. We've been providing laser eye surgery since 1995 here at our clinic. Knowing that you can access the doctor personally, all of my patients get my personal cell phone number so that any kind of concerns after a surgery of this caliber can be directed towards me. We also provide the latest in terms of the technology. Some laser platforms are very good at correcting, for example, astigmatism, whereas another laser platform may be better at providing nearsighted prescription, or maybe we need something with a combination to really give our patients the best outcome. Lasik is actually just an acronym for laser-assisted in situ keratomelusis, so much easier to say LASIK. Laser eye surgery involves using a laser to remove certain elements of the tissue of the front part of the eye, the cornea, and we're essentially reshaping the cornea to bend light to properly focus on the back section of the eye. In LASIK, we are essentially creating a flap and removing this flap of tissue, applying the laser, and we use the patient's own tissue then to come back down and heal. So typically laser will heal very quickly. It's really amazing actually, because you can expect to see very close to perfect vision or 20/20 eyesight the very next day after laser eye surgery. Macular degeneration is a loss of patient's central vision. So unlike glaucoma, where it takes away the peripheral vision, macular degeneration is actually quite the opposite, in where the central vision is obscured or lost. And we use our central vision for everything that we do, whether we're reading or driving or watching, TV. Sometimes there's a hereditary component. A lot of what the studies are showing now is a lack of pigmentation that protects the back part of the eye that is actually deteriorated from screen time. Smoking can contribute to macular degeneration as well. Typically, in the initiating stages of macular degeneration, like most issues with the human body, there's very little to no symptoms until it manifests and it's too late. There really isn't a treatment for macular degeneration in this day and age, but controlling macular degeneration is the key element. So patients' pigmentation is very important to be measured at every visit. For me, that's like a patient with diabetes needing to know what their sugar levels are. We need to know what our pigment levels are in order to prevent macular degeneration. We are the only clinic to provide what's called macular pigment optical density testing, or MPOT, which we perform routinely in all of our patients. This is from a very young age to very senior age as well. And from there, we're able to tell if there is an abundance or a lack of pigmentation that can contribute to the risk factors of developing macular degeneration. Myopia management is a relatively new term for a concept in preventing children's eyesight from deteriorating. When a child is diagnosed with myopia, one of the things that we do look at is the child's parents. Is there a family history of myopia? And how nearsighted does the patient get? So myopia is actually a disease, right? This is a progressive thing. Patients' eyesight deteriorates over time, and it seems to be a general kind of acceptance that another year has passed by, so we're going to increase the child's prescription. So the way that we generally prevent myopia from getting worse is establishing how big is the eyeball, and then what can we do to slow down the actual progressive growth. That's the real treatment in myopia management. Patients should choose primary eye care associates for their myopia management needs because of our experience. My own twins were diagnosed with myopia at age 8. They are now 21 years of age, and I'm very proud to say that my daughter has had very little change over the course of the last 12 years that she's been managing her myopia, and my son has had actually no change. So an experienced doctor from treating their own children and family members and use of the latest technology to help detect progressive myopia is very, very important. And we have all of that here at the clinic. PRK is photorefractive keratectomy. Laser eye surgery involves using a laser to remove certain elements of the tissue of the front part of the eye, the cornea, and we're essentially reshaping the cornea to bend light to properly focus on the back section of the eye. With PRK, we apply the laser directly to the cornea, and as a result, you're blinking over that raw surface. We put a bandage contact lens on the eye to protect the eye. So it takes about a week to 3 weeks to completely heal with PRK. If a patient's requirement is to maintain a certain thickness of their cornea, a lot of the times we will refer to PRK, or photorefractive keratectomy. Along the lines of different types of laser, there's another laser now called SMILE, which is an acronym for small incision laser. And this is a procedure in which, rather than creating a 12-millimeter incision into the cornea, about a 1.8 millimeter incision is made into the cornea. And this procedure differs from PRK and Lasik in terms of the fact that there isn't a flap that could potentially get dislodged. It also helps patients who have dryness of their eyes. There's less issues with post-operative dryness when we use the SMILE technique. We also provide the latest in terms of the technology. We're the only clinic in the state of Illinois at this time to offer a SMILE procedure for laser eye surgery.
I realized I needed help with my vision when every year I felt like I needed a stronger prescription. I chose Primary Eye Care Center. Basically, I found it off of Google, but then after reading so many fantastic reviews about the establishment, that's when I decided to choose this eye care center. So what impressed me the most about Dr. Chander is that I felt as soon as I walked into the establishment that they actually care. Dr. Chander doesn't rush in or rush out of the rooms. If I have questions, that's one thing about Dr. Chander that I've always noticed. He always makes sure to say before he leaves the room, do you have any questions? I would recommend this office to a patient that had something more serious than just needing a pair of glasses. This would be the only place that I would actually recommend them to, because I just feel that they do a complete exam.
I realized I needed help with my vision since I was like 6 years old. So from different diagnoses I had, I always needed glasses. I always struggled as well with dry eyes. Like my eyes just always felt like that dry, sandy feeling, and I never really knew why. I was always just, oh, here's some drops, put some drops in. So the day I had my procedure, I was able to come in. It was fast and easy. It wasn't really anything that I had to stress about. The staff here was amazing. They're comfortable. They were able to sit here and take all the time they needed with me to explain what was going on every step of the way and to make sure that I didn't have any questions about anything. So I would recommend this office to anybody who has any issues. If you have any questions as to eye health or what you need for your eyes, whether it's for prescription needs or even if it's just overall health, this is an amazing place to go.
So ever since I was 6 years old, I've noticed that I needed glasses. Every year, need glasses, but never I was told about my high astigmatism until I came to Primary Eye Care Associates. Dr. Chander was able to correct my vision. Ever since then, my vision is clear. My prescription through the year has not gotten up ever since then. I recommend Primary Eye Care Associates 100%. Dr. Chander is the best doctor to go with. Their staff is amazing, doctors are amazing. You get the attention that you need. I get a lot of compliments about my glasses. They always tell me, where do I get my glasses? Primary Eye Care Associates is the place to get them at.
I don't really have a lot of problem with seeing so much, but I have extreme dry eyes. You know, I investigated. I came as a patient to Dr. Chander, and he questioned me about my eyes. He did different testing to see how dry my eye was, and then he proceeded to explain the solutions that would help me. I've done a lipiflow, I've done different contacts, but the best contacts that helped me the most, they're called scleroshell, the specialty contacts that I could really have moisture on my eye. It was the best thing I did for my eyes. I always said I have absolute confidence in Dr. Chander and how he helps people with their vision, whatever possibility he can to get the best vision and best health for people. He's there to help them, and if he can't help them, he refers them out to other doctors. And as far as contact lens and how they evaluate your eyes and fit them properly, I would highly, absolutely recommend it. Hands down, Dr. Chandler.
What makes Primary Eye Care Associates unique for our comprehensive vision and eye health examinations is time. Our examination will be anywhere from a half hour to 40 minutes, where we will review our patients' personal and professional vision demands, so to speak, and how we can best correct that for our patients. Using state-of-the-art technology, we're always updating with the newest technology to provide our patients not only with the best eyesight, comfort, and clarity, but to also use this information for ocular disease prevention. Patients should choose Primary Eye Care Associates for their comprehensive eye health, mainly because of what we offer in terms of our services. We are never hurried in our examinations. We address all of our patients' primary needs and concerns, and we are always welcoming new patients to come into the clinic to help service at the same level as the referring patient has provided for us. Our staff is one of the most comprehensively trained, and we're always seeking further education for newer products and newer technologies to help facilitate the most efficient and most comprehensive examinations for our patients. Glaucoma is known as the most preventable form of blindness, and it happens in patients a lot of the times they're not aware. It's a very silent disease, and it takes over sometimes 5 to even 15 years to manifest any type of symptoms. Glaucoma harms the vision by taking away the peripheral vision very slowly. So what happens over the years is maybe 1 or 2 degrees of peripheral vision is taken away. So over a combined, 10 to 15 years, we lose that peripheral vision. Now, patients can maintain 20/20 eyesight in a tunnel-like vision, and then eventually that vision is taken away altogether. This is a condition that needs to be checked for on an annual basis from a very young age to a very senior type age. It can strike at any age, really. Restoration of vision with glaucoma, if there's pre-existing vision loss, is unfortunately not able to be restored. So again, it's very important to catch glaucoma at its very, very earliest stage. And once it's caught and the pressures are controlled, patients can actually have very, very great longevity in the clarity of their vision. At Primary Eye Care Associates, we offer the very latest in the technological elements of diagnosis of glaucoma. Prevention is the key thing. Rather than being reactive, it's very important to be proactive. We've invested in technology that not only helps to detect glaucoma, but can also predict the elements of glaucoma developing later on in life.